Welcome to Physician Focus. I'm Dr. Bruce Carlin. Eastern equine encephalitis, West Nile virus, and Lyme disease are infectious diseases carried by animals that each year cause concern among residents and prompt response by public health officials. While some communities have higher risks than others, and the incidence of human illnesses caused by these diseases vary greatly, all three are being found across Massachusetts with increasing incidence. This Physician Focus program, a collaborative effort by the Massachusetts Medical Society and the Massachusetts Department of Public Health, will examine the topics of mosquito and tick-borne illnesses. We'll look at how prevalent they are, how dangerous these threats are to humans, who's most at risk, and what each of us can do to protect ourselves against these infectious diseases. With me for our discussion are Dr. Alfred DiMaria and Dr. Catherine Brown, both from the Department of Public Health of the Commonwealth of Massachusetts. Dr. DiMaria is Medical Director for the state's Bureau of Infectious Diseases, and Dr. Brown is the state public health veterinarian. Welcome to you both.
Thank you.
Nice to have you here. So, what's happened? How come these diseases are so much more in the news today? Al?
Well, you know, infections transmitted by ticks and mosquitoes have become a big problem in Massachusetts. You know, there are a lot of factors that relate to that. Some factors like how we live, how we use our environment, how we, shape our environment, favors, for example, deer and ticks and mice that transmit Lyme disease. And, we faced West Nile virus arriving. We've always had Eastern equine encephalitis, and the population density has grown in Massachusetts over the years, so more people are exposed to environments where these diseases occur. The diseases are ultimately from animals. The mosquito-borne viruses, West Nile virus and Eastern equine encephalitis virus, are really bird viruses that spill over into people and cause disease. And the tick-borne diseases are coming from mice that we've created a perfect environment for them. We've allowed them to multiply in the leaf litter of all of our sort of fragmented forest environments in the suburbs. And this has provided the ticks with a blood meal from these mice that they also pick up these infections. So as the population has expanded, as the deer population has expanded that carries these ticks from place to place, we now have a situation where these infections occur around the state. And just because they occur, we're having sort of a bad summer in terms of these diseases. But just because they occur, it doesn't mean you can't do something to protect yourself and still enjoy the summer, enjoy the outdoors. But you have to be aware of the risk and what you can do to reduce that risk.
So what is the risk? How much greater is it this year than previous years?
Well, I would say that Lyme disease is continuing to be a great risk in the Commonwealth. It is the #1 tick-borne disease, not only in Massachusetts, but in several other states in the region as well. And so I would say Lyme disease, actually, the risk has already been growing and is really never going to get any less. I think this year we're really seeing some significantly increased risk from our mosquito-borne diseases, the West Nile virus and the Eastern equine encephalitis. And part of the reason I think we think that that's happening is how hot the summer has been. The heat that we've experienced this summer not only increases the development of the mosquitoes, but it actually speeds up development of the virus inside the mosquitoes. So it's kind of a double whammy, if you were. And maybe with global warming, if summers continue to increase in temperature, we may even see it get worse than this in the future.
Is there something about, well, you're the veterinarian, obviously, so is there something about the increase in the number of deer and the fact that we've got more deer around and more mice around?
I mean, as Al said, that certainly has played a very significant role in not only Lyme disease, but the two other tick-borne diseases that the deer tick can carry, anaplasmosis and babesiosis. And so we certainly have provided this wonderful suburban to rural environment that both the deer and the mice actually like to live in. So the types of areas that we like with the green spaces and maybe a little bit of separation from our neighbors have also really been a perfect place for Lyme disease to develop as well.
So what do we do public health-wise to improve our condition? You were touching on that before, Al.
Yeah, you know, I think it's critical for people to understand the risk and what presents a risk. I think there may be some misinformation about that. People have to understand where the ticks are likely to be so that they can take precautions when they are in those areas. They also have to understand that mosquitoes can carry both West Nile virus and EEE virus, and those both present a risk. And although West Nile virus tends to cause mild disease in most people who get infected, it can cause severe disease. And certainly EEE, Eastern equine encephalitis, could cause severe disease. It seems like in almost anybody who gets it, although it's much less common to get that infection. So I think things start with people understanding what the risk is, and then on the basis of that risk, on the basis of knowing when not to go outdoors, when if they do go outdoors, what to do, and on the basis of knowing where the ticks are and where the ticks aren't and how you can protect yourself, then you can take certain measures yourself to reduce your risk.
So what are those times to avoid, and what are those things to do, and what does the Department of Public Health do to help us with that?
You know, I mean, I think what we do is we gather information from a lot of different sources, including from animals, which is why I, as a veterinarian, am involved in some of this. But I think what we do is we look at information that we get from detection of disease in animals, detection of disease in people, and then also information that we get from some of our mosquito surveillance systems. And we take all of that information, put it together, and then use it to develop educational educational outreach to people and give them something concrete to do to help prevent disease in themselves.
So talk to me about some of those things that we tell them to do about, let's start with tick-borne disease. What can we do to mitigate the risk?
Well, the first thing is to avoid ticks as much as possible. And to do that, you have to understand where the ticks are lying in wait, because they want to attach and take a blood meal. And they'll do that when they get the opportunity. So, for example, if you stay in the middle of the path instead of along the side of the path, the ticks really can't get at you because they're sitting in the brush, they're sitting in the high grass, waiting to just latch onto you. They don't fly, they don't jump, so you have to go and rub against them for them to attach. To wear light-colored clothing so you can see the ticks on the clothing if they get on you. They're going to try to get to a warm, moist place on your body, the groin, the neck, under the arms, or at the hairline. These are all the places they're going to try to get at. Now, if you wear repellent, that can help because it repels them. And repellents containing DEET in particular are effective against ticks, and you can use another repellent, Permanone, on your clothes. You can't put it on your skin, but you can put it on your clothes. It binds to the clothes, and it not only repels the ticks, but can actually kill the ticks if they touch your clothes. So those are a couple of things. Now, if you can't avoid the ticks and you have the opportunity for ticks to be attached to you, the most important thing you can do is a tick check. At the end of the day, if you're in an environment where there might be ticks, so you're outdoors, in the brush, walking through the woods, walking along in a field, and there's an opportunity for a tick to become attached, then you need to check for any ticks on your body. Because if they're on for 24 hours or less, it's very unlikely the infections that they harbor will be transmitted to you. So if you take them out in an appropriate way within 24 hours, take them off your body, you can prevent the transmission of those infections.
Repeat that. How do I know a tick has been there less than 24 hours?
Well, you know, the ticks engorge with blood. They go from looking like a little bug to looking like a little bleb of blood. So, and that takes 3 to 5 days of attachment. So they're on for a while. They have an anesthetic in their mouth parts, so you can't feel them. And they have an anticoagulant in there, so they actually don't allow your blood to clot while they're feeding. So they can stay on there, and you really have to look for them, you know, either by feel or by sight, and then take them off. Now, if they're not engorged, if you check every day and you're at the end of the day and you check for all the ticks that might be attached to you and you take them off, you should be okay. If you miss a tick and you find it's engorged with blood, then you still should remove it, being careful not to break the tick while you're removing it. And then you might consider the option of discussing with your physician, your healthcare provider, whether you should take prophylactic antibiotics. In other words, an antibiotic to prevent infection, which is a one-dose antibiotic. Then the most important thing to do after, whether you take the tick off or not, is to be on the lookout for the warning signs of Lyme disease, which is the rash of Lyme disease. We call it erythema migrans because it's a spreading rash.
Spreading redness.
Spreading red rash that is very typical. Now, sometimes there's an atypical form of this, but 70% of the time it's going to show up as that typical bullseye rash, target rash, and that you need to be treated, because early treatment of Lyme disease is very important. And Lyme disease isn't the only infection, as Dr. Brown was saying. It's not the only infection these tick carries. There's two less common infections, but those are increasing as well. As we've seen Lyme disease increase over the years, we're now seeing babesiosis and anaplasmosis increase, and these can be serious life-threatening infections in people who are elderly or have underlying medical conditions. So these need to be watched out for. And a tick check and removing the tick early and removing the tick appropriately, you remove the mouth parts with fine point tweezers, or they have these little devices that lift the tick off your skin. You don't want to use kerosene, you don't want to use Vaseline, you don't want to use a match head to remove a tick. You want to remove the mouth parts from your skin. And if you do that, you can significantly reduce the risk and almost eliminate the risk of these infections if you do it early.
Help me with something. A lot of my patients have gotten their best pair of tweezers, which were in some antique kit or other, and they don't get all of the tick when they get it off. You know, they're a little nervous or whatever, and they leave a piece in. My comment to them is, you know, do the best that you can and don't go digging. What do you have to say if little bits are left?
Well, you know, the ticks, it's fascinating. Ticks don't have heads. They just have mouth parts. So they don't actually have a head. What you see as the head is the mouth parts. If you get most of that out, even if a little bit is in there, it's okay, because the salivary glands in the body of the tick, away from the mouth parts, is where the infections lie. So leaving a bit of the mouth parts in is okay. They'll come out, and you might get some redness. You know, it might be red for a few days. If that redness is just located at where the tick was and it doesn't spread, you don't develop fever or muscle aches or other sort of so-called flu-like symptoms, then you probably don't have the infection.
We don't have an awful lot of time to cover an awful lot of territory. Do you want to talk about mosquito-borne diseases?
Sure. Okay. So fortunately, the two most important things that you can do to help prevent getting a mosquito-borne disease are really similar to what you can do to prevent a tick-borne disease. So one is cover up exposed skin, at least when it's not, 95 degrees outside, and use repellents. And when you're looking for a repellent, you really want to look for one that's EPA approved, and they'll actually say that on the label. There's a huge variety of products to choose from. Not all of them are equally effective. So concentrate on looking for one with an EPA-approved repellent. So those really, again, those are things that you can do to prevent tick-borne diseases, but also prevent mosquito-borne diseases. Now, the other thing that you can do to prevent mosquito-borne diseases is to avoid times of day when the mosquitoes that are likely to spread disease are most likely to be active. There are a lot of different kinds of mosquitoes. Not all of them carry disease, but the ones that we worry about in particular are most active between the period of dusk to dawn. Now there's some variation in that, but really if you think about limiting your outdoor activity during those time periods, just shift your schedule a little bit so that you're active kind of later in the morning or earlier in the afternoon, then you can avoid actually being outside during the time when these mosquitoes are most likely to be out looking for food, So those are kind of the key things that you want to do to prevent mosquito-borne disease. Now, unlike ticks, ticks, they have to bite, they'll be attached while. Mosquitoes, it really only does take one bite. However, most of them, the good news is, are not infected. So you just want to limit the opportunities they have to bite you. Now, West Nile virus and Tripoli, they both really present sort of similarly. You may develop symptoms anywhere from 3 to about 7 to 10 days after a bite if you've been infected. And you're going to start usually with kind of flu-like symptoms, achy feeling, headache, fever, and if you have Eastern equine encephalitis as opposed to West Nile virus, your condition will likely deteriorate pretty quickly after that. It's a very severe illness that can affect your brain. With West Nile virus, actually, most people who are infected will never even know it. Their immune system will just clear the infection and there won't be a problem. About 20 out of 100 people who are infected will really have kind of a mild flu-like illness. They may not feel very well, but there won't be any severe consequences associated with it. 1 out of 100 people who are infected will develop severe disease, and it will look a little bit more like Eastern equine encephalitis, where it will actually affect the brain.
Is that more dependent on the host, on factors that that you, the host, bring to the table rather than the mosquito?
Yeah, that's actually a really good question. So for West Nile virus, actually, we have found that older populations are actually more likely to develop severe disease. Eastern equine encephalitis is different. We actually find that kids and then also the older population are ones that are more likely to experience severe disease, although Tripoli really is kind of less of a respecter of age than West Nile virus is.
So some of the public health suggestions to towns to not have night baseball, for example, are based on this. So how do you pick which town to tell, geez, night baseball isn't probably a good idea this month?
So we look at there are many mosquito control projects out there. So towns may choose to belong to a mosquito control project that will help with trapping mosquitoes to bring it into the state lab for testing, and will also do ground control of mosquito populations. And so we test those mosquitoes for virus, and when we find places where there is intense virus activity in mosquitoes, then those are the towns that we tend to recommend that maybe it's a good idea to reschedule evening outdoor events.
But you do other things too. This is I personally find this a really heartening use of public health, that it really is right on the front line, preventing disease. The other stuff that you're doing with very limited spraying and the other things that you do on the mosquitoes. Can you go over a few of those things?
So, I mean, I appreciate your interest in a lot of those things, but I do also just want to stress that the mainstay of prevention remains actions that any individual can and should take to reduce their opportunities for getting mosquito bites. So that's the mainstay of prevention. But the mosquito control projects are extremely active in their communities, and they will do ground-based spraying to control mosquitoes, mosquito populations, both for nuisance control, but also in response to any identifications of virus, either West Nile virus or Tripoli. And they probably have significant impact during the season because they're able to go out sort of at a moment's notice in response to finding of infected mosquitoes and do control activities.
So it's a laser attack on
a surgical strike, if you will.
Surgical strike on the mosquitoes.
It is. I mean, they know their towns, they know the habitats that are most likely to produce the mosquitoes that we have to worry about, and they're able to do some very targeted response. Now, this year we've had such an unusual situation with Eastern equine encephalitis, and the risk was so widespread earlier in the year that really it was felt like the surgical strike wasn't going to be a sufficient option. They did a lot of work, the mosquito control projects, and they're continuing to do a lot of work. But the risk was so great and so widespread, and included some areas where the mosquito control projects really couldn't get in to do their work, places without roads. And it was necessary to do an aerial application of pesticide to help control mosquito populations. Again, that's really sort of a tool that can be used in times of extreme risk when our more standard prevention messages and the mosquito control projects when that is not sufficient to help reduce risk.
So what other things in the environment can we deal with? I know if you got any tires lying around with standing water, what other ideas do you have in that direction?
Well, in addition to all the personal behaviors, personal protective behaviors that people can do, you can also do things around the house, around your environment. You can reduce mosquito breeding sites by making sure there's no standing water. You know, the tire is the classic because no matter where you put it, water can stand in it. But the bird bath, the ponds, the small areas of standing water, the mosquitoes, mosquitoes can fly distances, but you're still more likely to be bitten by a mosquito in your own yard. So, and those mosquitoes may be breeding right in your own environment. So you can reduce standing water and reduce the amount of mosquitoes. Check your screens, make sure the mosquitoes aren't getting into the house in the night and biting you in the night. So there's things you can do around your house. There are even things you can do to reduce the risk of tick exposure. And if you go to the DPH website, which will be presented shortly, you can get links to how you can change the landscaping in your yard to reduce the risk of ticks, because they don't like to be dehydrated. So just a matter of putting in various areas of mulch and areas of drier plantings can reduce the likelihood of ticks coming onto your property. And then you can take the personal protection interventions, the personal protection behaviors, and use those when you go off your property. But I think there's a lot of things that people can do, and there are a lot of suggestions on our website about how to do those things.
What about some of these commercial mosquito traps where they're making carbon dioxide and zapping the mosquitoes? I mean, you get a wad of mosquitoes at the end of it. Are they a proven technique? Do they work? Or?
I haven't seen scientific evidence that they really reduce the risk of human disease. And one of the things that I think we both worry about is that if someone is really thinking that that is going to protect them and they have that in their backyard, then they may not be taking that extra step and using the mosquito repellent at the same time. And using mosquito repellents, covering up, those are really proven to be effective at reducing your risk from disease.
And we worry too about when aerial spraying is done, or even when ground spraying is done, people somehow think the problem's been taken away, or somehow all the mosquitoes have been killed. But not all the mosquitoes are killed, and mosquitoes come back again. They continue to breed, and they will come back again. So we're just reducing the risk for a temporary period of time. We're hoping that that's enough to prevent human cases of disease. But it doesn't mean you can stop taking the precautions to protect yourself against mosquito-borne illness, because the risk is still there. It may be reduced, but it's still there. And if you're not taking the precautions you were taking beforehand, you might be actually at higher risk in a situation where you're not taking any precautions at all. So we really want people to understand that aerial spraying, all these mosquito control interventions are very important in reducing risk, but they don't eliminate the risk, and the precautions have to be taken.
Personal prevention remains the mainstay.
So do you have some final words to reiterate, emphasize, repeat, and tell our audience about concerning tick-borne and mosquito-borne diseases? Catherine, why don't you start?
So when I talk to people about these diseases, one of the questions they always ask me is, should I be scared? And really my answer to that is, I'm not looking for fear, I'm looking for awareness. I want people to understand what the risks are, but I also want them to feel empowered and know how to protect themselves. And really it's all about making it less likely that you're going to get either a tick or mosquito bite. And covering up exposed skin and using repellents are the way to do that. If you also think about rescheduling outdoor activities during those peak evening mosquito activity times, if you can think about avoiding brushy areas where ticks like to live, and if you throw in a daily tick check, you've got all your bases covered.
So you can have fun and you can enjoy the outdoors during the summer. As long as you're aware of these potential dangers and you're taking appropriate precautions, you can have a good time. You know, you don't want to sacrifice your health to have a good time without taking these precautions. So you really need to pay attention to this, but still keep it in perspective. So if you reduce your mosquito bites from 1,000 to 100, you've already reduced your risk by 90%. So you might not be able to prevent every mosquito bite. You may wind up with a tick on you at some time. If you do the best you can to take these precautions, then you've really reduced your risk by using repellent, doing a tick check, and avoiding both ticky areas and times of the day when mosquitoes are more active, trying to not go out in those environments.
Well, thank you both. This has been a wonderful discussion, and that does it for another edition of Physician Focus. For more information on mosquito and tick-borne diseases, visit the websites listed at the end of our show. And to review past programs of Physician Focus, visit our website at physicianfocus.org. Thank you for watching. I'm Dr. Bruce Carlin.
I'm Dr. Catherine Brown. West Nile virus and Eastern equine encephalitis are two infectious diseases whose presence is increasing in communities across our state. Both are spread through the bite of infected mosquitoes, and exposure is greatest in the warmer months. While human cases of the diseases are rare, both EEE and West Nile virus can cause serious illness, permanent disability, and even death. Here's what you can do to protect yourself. Use an EPA-approved repellent such as DEET. When possible, wear long pants and long sleeve shirts to keep mosquitoes away from your skin. When your community advises, avoid outdoor events between dusk and dawn when mosquitoes are most active. Keep mosquitoes out of your house by repairing screens and closing windows. Remove areas of standing water around your home that serve as breeding grounds for mosquitoes. For more information, visit mass.gov/dph/WNV.
I'm Dr. Al DiMaria. Lyme disease is caused by bacteria spread by infected deer ticks that occurs throughout Massachusetts at any time of the year when the temperature is above freezing, but the risk is greatest in the warmer months when the ticks are most active. The disease creates flu-like symptoms with fever, rash, headache, sore muscles and joints, and fatigue. These ticks can also carry other infections. If you suspect you've been bitten by a tick and develop a rash or become ill, see a physician promptly. Early treatment with antibiotics is important to prevent more serious medical conditions. No vaccine exists for the disease, so the best prevention is protection. If you spend a lot of time outdoors or live in tick-infested areas, such as those with overgrown grass or lots of bushes, use an approved repellent and wear long pants and long-sleeved clothing. And perform a tick check on yourself after each time outdoors. For more information, visit mass.gov/dph/tick.